I'm a little bit humbled because I'm speaking on behalf of work that was really initiated by Uganda through Lens about 2 years ago, um, but it's taken off. And I think that what I'd like to do is maybe provide a little bit of framing, and then I'm going to ask my colleagues from Uganda to chime in to talk about why this approach is particularly meaningful and what it represents in terms of transforming the way that biomarker data are collected and used to inform programs. So I hope that I can do this well. I mean, the vision of this work are just threefold. I mean, one is that we need to be able to have more continuous data on vitamin mineral deficiency prevalence. The data that we collect, Nigeria, first time in 20 years, other periodic surveys, infrequent. They're not available. And when they are available, they're not necessarily available at the subnational level to help inform programming. What we believe that we can do is to leverage the experience of other surveillance systems. Learning network for nutritional surveillance, not lost on us what Lens is all about. What Lens is all about is to make optimal use of existing government-owned systems within countries to be able to generate data that will be programmatically meaningful. The last part of this first bullet is really important, and we didn't realize this from the beginning. The original idea was, let's be opportunistic, let's leverage remnant samples that are collected through infectious disease surveillance, thaw those and analyze them for the micronutrient content. And we'll be able to develop maps of the subnational prevalence of different deficiencies. What we didn't realize at the time, and what our colleagues in Uganda helped us really appreciate, is that these same samples that are being subjected to analysis for the micronutrient content have already been analyzed, in some cases for HIV, some cases for malaria, in many cases for inflammation status. So we have a common database that enables information not only on micronutrient status and micronutrient deficiency, but also on levels of inflammation and levels of different infectious pathogens. It's an incredible opportunity to align surveillance systems that really goes beyond just nutrition. It's truly multisectoral in a way that could be powerful. The second thing that we're really excited about in this particular approach is that a lot of surveys are conducted in which specimens are collected and then sent out to foreign laboratories. An aspiration of this work is to strengthen and to embolden national laboratory capabilities. What this does mean is that the instrumentation, the equipment, the diagnostic platforms that are available may not be gold standard, but they may be sufficient enough to be able to generate information that will be programmatically meaningful. And really what this is ultimately all about is to drive public health decisions, to be able to identify within countries which are those areas, which are those geographic regions that have the highest probability of vulnerability or inadequate intake or inadequate deficiency. So the challenge is that we need these data. I mean, the last 2 days we've talked about understanding the etiology of anemia. In order to do that, we need data to inform that. We don't only need data on hemoglobin, but we need a lot more. We need data on micronutrient deficiencies. We need data on inflammation. We need data on malaria. Ideally, we also get information on inherited genetic blood disorders as well as other factors. But at minimum, we need to have these data, and we need these data more frequently. And the second part of it is that we just have to acknowledge that conventional approaches are expensive and cumbersome and challenging. So what we've done is really on the leadership of the Central Public Health Laboratory in Uganda is to begin to explore the viability of leveraging biological samples that have been collected through population HIV assessments that have been put in biorepositories and frozen, extracting those, sampling them, understanding the sociodemographic characteristics of each of those samples, thawing them and analyzing them for their micronutrient content. So Uganda is really taking the lead in doing this. And Uganda, again, said it's not enough to just analyze these surveys, these HIV prevalence surveys that are conducted every 2 years in 17 countries in Africa. But we want to also explore the viability of collecting biological samples that are gathered on a routine basis through their primary healthcare system and transport those to compile it for analysis. So really trying to think about what are the different ways in which we can access remnant samples without going out and doing new phlebotomy or new blood collection. Tremendous savings and tremendous efficiencies. The other half of this equation is that once the samples are thawed, we have to analyze those. And our initial work was to leverage a particular platform that was developed by Quansis, which is a multiplex ELISA, sandwich ELISA, that enables the analysis of vitamin A, iron, and iodine status, as well as markers of malaria, acute and chronic inflammation, at a fraction of the cost of what would be required to analyze those specimens in a foreign laboratory. So this process, this approach, basically is made up of two components: specimen acquisition and identifying different ways to get these biological specimens, and the second part of it is really being able to subject those specimens to further analysis. We've gone a lot further, and this is because of the work in Uganda, that we realize that this is just scratching the surface. In terms of geography, we know that we can do this in other countries, and I think that it's something that the Lens Network is uniquely poised to be able to explore and to expand and to extend in a way that will be useful. We're going to need to establish a proof of concept, and CPHL is doing an extraordinary job in demonstrating the viability of these specimens once thawed, to make sure that the specimens themselves are pristine and have not been compromised, and then to basically begin exploring how we then go beyond this initial FIA, population health indicator survey, to tap into other sources of data. What we're also doing is we're also going beyond Quansis to say that their current platform could potentially be expanded to include indicators of serum folate and cyanocobalamin, vitamin B12. But we also think that there are other platforms that may be available that can subject analysis of these small samples for micronutrient content, for inflammation, as well as infectious disease pathogens. Building a system, building a structure so that routinely we're able to generate these data so that ministries of health will be equipped with the kind of information that's needed to guide anemia control programs, understanding what are the specific factors that are leading to anemia that can potentially be addressed through having more robust and systematic data.